go.
Okay, and we should be live.
Awesome.
Okay. Welcome everybody to the live stream. This is an interview with Danny Bossa this evening about things to know before starting testosterone replacement therapy. Danny Bossa is in our Facebook group, TRT and Hormone Optimization Therapy, HOT, and he helps a lot of guys there out with his own experience on TRT. So welcome, Danny.
Thank you. And you've been doing a hell of a job. I've been to so many different forums and channels and pages, and this is the only place I come to now. The rest, I've completely lost interest. If you guys aren't subscribed to this channel, then you're just not on the right track.
Well, for all the viewers, if you haven't already, please join our closed group. The link is under this video. So I'll let Danny do a lot of talking for the next 45 minutes, an hour maybe. If you have any questions, just type into the chat box. I will gather them and give them to Danny at the end of this interview.
Awesome.
Okay. So let's go, Danny. First point, how did you feel before you went onto TRT, and why did you even think there was something wrong?
Yeah, so it started, I would say, probably in about my mid-30s. I was married at the time. I already had 2 kids. I was getting enough sleep, wasn't really feeling rested. I would wake up in the morning very tired. I was training off and on at the gym, and not really getting any type of progress or any gains, no matter how much I tried to lift heavy or to eat well. And I would see guys at the gym that were just, talking on their cell phone and wasting time, and they're just growing and getting bigger and stuff like that. Libido was really starting to kind of tank. Getting it up was really starting to be an issue. I think if the fate of the world was dependent on me getting it up at one point, we wouldn't be here right now. Had a big kind of lack of confidence, even though I was working for myself, I was doing well, life was good, just felt a lack of confidence, felt very timid and fearful of stuff. I would worry about stuff. I would get intimidated easily. Felt a little bit, I'd say, depressed and just down. And then physically, on top of not really putting on any muscle if I was going to the gym, I was putting fat on in odd places. I was getting fat like on my chest. Even to this day, it's still kind of soft, but it has improved. A lot of fat on the chest, fat in places that men don't typically put fat. Was even getting a nodule under my left nipple, was like this lump that was forming. So I knew that something was off. I had no idea what hormones did or what they were or what people do in these types of circumstances. So, I had mentioned it to my mom at the time, and she was seeing this endocrinologist at a local hospital, and she says, I'm going to make you an appointment, and she's very, very good, and so on and so forth. So I went over there, and the first thing was get a blood test. I had a massive aversion to needles. Just the sight of a needle would make me pass out. So I'd have to get the needle and just kind of look away, like a child. And she measured a hormone called testosterone, and a couple other minor things. And I waited about 2 weeks, and 2 weeks later, I still had no news. And I called back and I said, I'm just wondering if you have some news. And she goes, oh yeah, we didn't call you because you're fine. And I said, okay, like, how did you determine? She goes, well, on the range of the scale of what you should be measured at, you should be between here and here. And as long as you're in this range, she says, you're fine. She says, you have to be outside of that range for there to be an issue. And as much as I wanted to believe her, I wanted to see some kind of evidence about this. And she sent me the lab work with a lot of arguing to get the lab work from my own blood that I had measured, which was kind of crazy. And I didn't know really much of all of these things that were on this chart, but I could see what the range was supposed to be. And I could see if I was, in the middle or at the top or at the bottom, or if I was off. And the hormone called testosterone The range is, let's say, from measured from 300 to 1100, and I was at about 260. So I immediately emailed her back and says, I'm noticing testosterone here, which I know is supposed to be important. I'm lower than what I'm supposed to be. And she goes, yeah, but it's not significantly lower. She says, you would have to be significantly lower than that for it to be a problem. She says, you're very close to being in range. And again, as much as I wanted to believe her, that didn't make sense to me. So I spent about 1.5 years of different diets, trying different multivitamins, trying different minerals, trying hormonal, herbal remedies. I tried going to an acupuncturist. I tried going to see a psychologist. I said, maybe it's all in my head. The psychologist says, well, maybe we can start you on antidepressants. I said, but I'm not depressed. I have nothing to be depressed about. My life is good. I just feel like shit, and I don't know why. There's something off. Kept going to the gym, trying to train, and I'd put on a little bit of muscle, but with an unbelievable amount of effort, and it just didn't make any sense. And then I would get pissed off at my progress. So maybe I'm just not smart enough to figure out how to train or how to eat, and I would stop. And the second I would stop, literally within 2 weeks, I would just go. I would shrivel up to this tiny little toothpick. My gains would disappear in 2 weeks. It was unbelievable. So then I started saying, maybe it's this hormone stuff. Maybe the doctor got it wrong. So I started learning about testosterone. I went on all these, forums and, pages like yours, but a lot of them where it was what's called bro science. It's every Tom, Dick, and Harry sharing their experience. This is what I do, so on and so forth. A lot of it was a waste of time, but the more and more you read, the more and more you could see the ones that seemed to know what they're talking about. They went into more detail. They could back up their arguments. And I started picking up more and more and more and more. So I realized that the whole issue could very well be hormones, contrary to what this doctor would tell me. The doctor at the time had even inspected my testicles and said, well, your testicles look fine. And she says, and because you've already had kids, that would imply that you're fine. Yeah, I had kids years ago, but I don't feel fine now. Which is, well, your testicles look fine. You've had kids. You're almost within range, not quite, and so on. So I needed to kind of figure out, how this all happened. I was under the impression that everyone at the gym was on steroids because no matter what they did, they were growing. I wasn't. I started to suspect maybe I just have bad genetics, and frankly, I'm a problem solver by trade. So I have an IT consulting business. I solve problems. You give me a puzzle, regardless of what it is, and I'm going to figure it out. That's what I do best. So for this was a puzzle where I'm going to professionals for help, and none of these professionals could really provide me anything that made sense or anything that was solving the issue. They were just disregarding it. So after reading enough on these forums and stuff, I knew that it was time that I had to find a doctor that did what's called TRT, testosterone replacement therapy. You can also call it testosterone optimization therapy, TOT. And basically, for those of you who have no idea what TRT or TOT are, just like I did at the time, TRT is basically a matter of putting back what should have been in your body to begin with. So if you look at the guys that are very athletically gifted, they've got good muscle tone, they don't put on a lot of fat, their skin looks young, they always seem to look young. Typically, if they're not doing anything that is really that they're purposely trying to modify their biology, so to speak, it's usually because they just have naturally very high levels of testosterone, and testosterone peaks when we're in our teens. The levels get ridiculously high, and then they just start kind of going down. And with every passing year, it just gets lower and lower, which is normal. With some people, the levels just will be going down slowly, and all of a sudden they just take a nosedive, and they just and then you just kind of feel kind of like crap. So I tried to find a doctor that would kind of help me better understand what I maybe would need to do and what kind of treatment options there are, because I knew something needed to be done. It was definitely hurting relationships. When you have a gorgeous girlfriend, and she wants to have sex, and you think she looks hot, but you can't get it up. you can't do anything. They get upset. You know, is it me? Am I not attractive enough? Am I not? And you're constantly having to answer these questions. It's like, no, it's not you. You look great. It's me. And the women just, you know how women are. They just don't believe it. I went to a doctor at one point, and he says, well, maybe you just need Cialis or Viagra, which I tried. And here's the interesting thing with Cialis. You take Cialis, and yeah, you're like this. Problem is, you still have no desire. You're doing it, but you're not getting much out of it. So your body parts are working, and you're just going through the motions, and you're thinking of, you know, tomorrow I got to call that client, and don't forget I got to make the quote for that guy, and oh shit, I never wrote that guy back. And you're having sex with, and you're like, this isn't normal. This can't be. You know, I should be, you know, just, you know, ravaging this woman right now. I should be so excited. I can barely contain myself. And I just wasn't feeling that I used to feel when I was a kid. And or when I was a teen, at least, or late teens, early 20s. And doctors would say, well, you know, you're getting into the high 30s and it's normal and sex drive. And I'm like, well, if this is what I'm now going to expect for the rest of my life, and if this is just going to get worse and worse and worse, like this is going to suck. Okay. So I had to find a doctor to help me out. That was so challenging. Doctors have admitted to me straight out that when they go to med school, they have so many things they need to learn. And typically what it is an emergency room type situation. Guy comes in, his symptoms are blah, 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 you prescribe this. Guy comes in or whatever, you do this, or you prescribe this drug, or you prescribe that drug, you prescribe that drug. So someone like me, oh, you know, I can't get it up, but I don't feel good. Well, we'll give you Cialis, and we're going to give you an antidepressant and fuck off, basically. And that wasn't enough for me. I just said, okay, but why do I feel like this? Giving me Cialis or giving me an antidepressant is going to, you know, antidepressant will mask the problem and make me feel better. And the Cialis, well, yeah, it's going to make it work, but I still don't feel like I should be feeling. So I did a little bit of research, and I found this one doctor who turned out to be a doctor who was kind of an expert in steroids and performance enhancing drugs for athletes. So he would manage or handle the health of athletes who were high level athletes that needed to have higher levels and were taking substances to get them to compete at the level like everyone else was. And just so we're clear and we understand about if I can just back up for a sec, guys that have high levels of testosterone naturally, yes, they're in shape and all this type of stuff. But if you were to take very large doses of testosterone so that you are what's considered super physiologic means way beyond what your normal physiology can produce, then it's considered steroids. You're basically putting on muscle, and you will typically have a lot of side effects with that. So it's a very kind of delicate thing to get into. I was training. I didn't want to get on steroids. I just said, I want to be optimized, if you will. I want to have what I would need to do what it is I need to do. So I met with this doctor, I discussed whatever. He had no idea how to do TRT. He just knew how to prescribe steroids. He referred me to an endocrinologist. Went to see this endocrinologist, which took 2 months to get an appointment, walked in, and the endocrinologist basically said he was going to give me 400 milligrams of testosterone once a month, an injection once a month. And I knew enough at that time to basically laugh and say that what he was suggesting was criminal. Some of you may be asking why. The body basically produces testosterone all the time. You're constantly, you know, there's a little barometer in your body, and we'll get into a ton of detail just to keep it in simple English. And as soon as it sees the testosterone starting to dip, it creates some more. So you're constantly getting a pulse of hormones. A lot of it is produced in the morning. If you were to take a big dose at the first of the month, yes, for the first couple of days, you're going to feel great because you got this massive dose. You're like, ooh, I'm like, I'm, you know, Superman. And then over time, it's just going to get less and less and less and less and less and less and less. By the time you get to that last week, you've got so little testosterone left that you just feel like dog shit. Typically, when you're doing this type of thing, it has to be on a pretty regular, either a daily administration or you know, at the very least, twice a week, weekly, you know, the more often, the better. So I left his office and realized he didn't know what he was talking about. Went to see another doctor who told me that I should take something called androgel. Androgel is basically a gel. It comes in these little packets. You open it up, you spread it on your arms. Your skin is supposed to absorb this gel that contains testosterone. Your levels are supposed to go up. Spent months and months and months and months and months lathering myself with this gel that literally did nothing. When I was mentioning earlier that the range is between 300 to 1100, I never got quite above 500. And just to go back, when I said my levels are about 260, 270, I forget what it was, that's basically the levels of like a 90-year-old man. You know, my dad's 72 years old and he probably had triple the testosterone I had at that point. That ended up being a waste of time. Then my wife wanted to get pregnant. We knew that having low testosterone or being on any type of testosterone can lower sperm count. I had to take something what's called HCG. HCG basically stimulates the testicles to produce more sperm, to up your sperm count. They had no idea what it was all about, so I had to change doctors yet again. Went to another doctor who knew how to do HCG, or at least knew a little bit of it. But he had no idea how to treat a patient based on how they felt. So I would basically sit in front of this doctor and he wouldn't even look at me. He would just look at his paper and he'd be like, okay, so your testosterone is low and this is high and this is, and he wouldn't ask me, how do you feel? Do you feel well? How, you know, what are your issues? He would just look at the numbers on the paper and judge his way of treatment based on the numbers of the paper. So if you came in and your testosterone was a little bit too high, he's going to drop your dose. It doesn't matter if you feel fantastic at that point. It's like, oh no, it's too high. We have to drop your dose. That ended up being a challenge, getting him to do anything. Maybe I'm rambling on here, so you can stop me. So at one point got onto this HCG stuff to help with fertility. That made me feel absolutely beyond terrible. I had body pains all over, around the groin, body pains, my legs, my lower back, everything just ached for weeks. And I wanted to get off it so bad, but my wife wanted to get pregnant so bad, I just had to stay on. And I toughed it out as much as possible until eventually she did get pregnant and I stopped. And it's been a really long and difficult process. The thing with me is when I have a question, I want to know what is the right answer. Just give me what the right answer is. And what makes this so complicated is there is no real right answer for anybody. It's a matter of experimenting. What works fantastic for one person, it can make another person feel like crap. So basically, the whole point of this was to optimize my testosterone levels. And as soon as they were starting to feel, you know, as soon as the levels were starting to get up to something that made sense, my sleep was way better. I remember just being, you know, sleeping 9 or 10 hours and waking up the next morning and I didn't want to get out of bed. I would go to sleep now for 8 hours and wake up and ping, I was just wide awake. I could get out of bed and my brain was alert. My brain was already working. I would fly through my workday getting way more work done than before. My brain power, it's as if somebody injected some smart chemicals into my brain and I felt I got smarter. I could think more, I could do more, I could be more productive, I can concentrate more. I would solve problems faster. I would start going to the gym and just for what I was doing before, I was putting on muscle, which was fantastic. I wasn't growing like somebody on steroids, but I was putting on it, the muscle that I felt I should always have been putting on to begin with. And if I would take a break, I wouldn't lose it. So my wife and I, we were training like 4 or 5 times a week up until she got pregnant in September. I had not gone to a gym since September because we just had so much stuff going on, and we're going to get back at it as soon as the baby comes. But you look at, let's say, my arms. Okay, I have not trained since September, and I have biceps. Okay, I'm keeping whatever muscle I put on. I kept about 80% of it, and I haven't done any bicep curls since September. I've just maintained a lot of the mass that I had, which is great. Libido is way better. You know, I look at my wife now, and it's like I need you now. Like it's like the little animal goes off in your head, and you can't stop yourself. I didn't have that before. The energy, the energy throughout the days. You'd think that you've been having coffee all day without that stimulating buzz, like you had too much coffee. Just this endless stream of energy, and it's 8 o'clock at night, and you're still going. Let me do this. Let me do this. Let me do this. I get so much more done in a day now compared to before. It's unbelievable. A lot of the aches and pains I had joint pains, I had back pains. I was seeing a chiro, I was seeing an osteopath. That's gone. What's it called? A sciatic nerve thing. I would get that every week, limping around. That's gone. I just feel better. I feel like a better man. I feel like I have a better intellectual power, if you will. I'm way more productive. I'm a better husband, a better lover. I'm a better everything. And it was all just a matter of getting these hormones balanced out, and not just balanced out in the middle of the range. If you're going to do it, you want to be, you know, towards the top end of the range, or maybe even slightly above the top end of the range if you're going to do it. So people have asked me, you know, what is it that you do? Stephen, you can stop me at any time. Eh? I'm just
No, I don't want
rambling
to
on here.
interrupt you. Still very interesting to listen to your story.
Okay,
Go
good.
on.
So they asked me, you know, what is it? You know, how do you take this testosterone? Do you take a pill? At first, I thought it was maybe going to be a pill. You can't really take testosterone orally. In certain situations, and I won't really get into details, you can. And most of the time, it's liver toxic. Basically, the options are either a gel that I was mentioning before. Gels, typically the concentration of testosterone isn't really quite high enough to get your levels up to where they're supposed to be, so I don't really like that too much. You can have injections, which at the time scared the living shit out of me, because if I would just see a needle, I'd pass out. I couldn't even look at a needle. Never mind trying to inject myself with anything. Some other doctors go this route called pellets, and they're basically implanting these tiny little pellets into your butt cheeks. So it's a minor surgery where they put them in the butt, and the pellets will basically slowly release testosterone over time. I completely am not for that whatsoever, and I think it's personally a barbaric practice, and I don't think any doctor should be doing it unless they're just trying to make a buck. You have creams. Creams can be applied, which I tried for a short time, applied on the body. They can also be applied through the scrotum, and through the scrotum, because the skin is so thin, it absorbs way more of the testosterone. I've never actually tried that. The way I started was after all the androgel and stuff, I started with injections. So a lot of people they can't picture, you know, you inject yourself, like this is crazy. I'll just kind of quickly show you, for those of you who are needle phobic, if you will, what it looks like. And this is how I ended up starting to do it. So if you're thinking of about some like big needle that you could like jab into your shoulder and it goes, like, it's nothing like that at all. Okay, so I'm just gonna pull this off. And I'll see if I can show you. I don't know if you can, do you see how small that is? I don't know if you're seeing it well enough. I mean, I don't want to say the size of a mosquito, but it is unbelievably tiny. And when I saw how small it was, I said, I'm sure I could do this. And basically what I do is load up a syringe and I just push it through the belly fat. And in a lot of cases, I push it through with literally no sensation at all. It's kind of like a hot knife going through butter. And every once in a while, I'll push it through and I feel like a little, like, ooh, just a little pinch. Nothing to cry over. It's a little tiny little thing. And that's been working for me fantastic. I started off with my wife giving me injections. I was literally lying down on a couch on my side, curled up in a ball, almost in tears. No, 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 please, 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 no. And she would jab me, and it, I look back now and I laugh how much of a pussy I was. Eventually, she got sick of doing it, and she says, "You're gonna have to do it." And I had to just man up and do it myself. And it's a really odd sensation of, sticking yourself, stabbing yourself for the first time. It's your brain doesn't go that way. Now that I do it, it's literally, it's part of my routine, like taking a shower or brushing my teeth. I come out of the shower, I brush my teeth, and it's done. I started off doing it once a week. With the once a week thing, I was kind of feeling that, oh, I feel good. And then over the course of the week, oh, I'm feeling not as good. And then at the end of the week, I was like, man, I'm really anxious for my next injection. So I would take my weekly dose, I would divide it by 2, and I was giving myself an injection twice a week. And I felt better. And I started saying, what if I give it to myself every other day? Every second day, I felt even better. So what happens if I give it to myself every day? And every day, it has been even better than it was before. Now that I've gotten used to doing it every day, it's literally 60 seconds out of my day, and I would never go back to anything else. I don't know if you want to stop me and ask me a question or...
Well, I don't think we have to go into specifics of exact milligrams or whatever. No, go ahead. I think you can give more tips on injecting or mistakes you have made.
Sure. So as soon as you guys start getting onto this thing, for those of you who were planning on starting, or those of you who are just starting and maybe have found a doctor that seems to know what they're doing and so on and so forth, the biggest mistake I think that I made was you start going on the forums and you start reading up on what everyone is saying. And, the doctor's telling you one thing, and the people on the sites, I've been on TRT for 15 years and I take this and I do this and I do this and I do this. Again, it's like what I said, we are all completely unique. There's some stuff that I'll take that I'm going to feel like crap. And if you take it, you're going to think it's the greatest thing in the world. And we can't really together tell people whether to take it or not. It depends. You have to try it and you have to see. How much testosterone are you supposed to take? Some people, they take a little bit, they feel great. You feel great, we'll leave it like that. Some people need a lot more to feel great. Some people need in the middle range to feel great. So a lot of these doctors will give kind of a cookie cutter approach. He says, okay, we're going to start you off with 150 milligrams of testosterone a week, and you're going to take this other stuff called DHEA, which is in pill form. You're going to take this other stuff called pregnenolone, which is in pill form. And you're going to take vitamin D, and then we're going to try to control your estrogen, because the testosterone can convert to estrogen. Estrogen is the female hormone. We were taught for the longest time that men don't want to have high levels of estrogen. We actually know that that's not necessarily true. So you just take all kinds of stuff. The problem with taking all kinds of stuff, and I know there's a lot of doctors in your group that are going to argue with me. Some people wind up on the forum saying, I'm taking tests, I'm taking DHEA, I'm taking the pregnenolone, I'm taking vitamin D, and I'm training, and I'm eating well, and I'm doing everything the doctor said, and I feel like dog shit. Why? It could be any one of those things. So if it could be any one of those things, why not take a more logical approach, which for me is way more rational, and say, okay, let's go back to basics. Start by taking only testosterone. Forget everything else. Start by taking a decent dose of testosterone, let's say 100 milligrams a week, and test it out. And it's not like turning on a light switch. It's not like if I go to my light switch and I turn it on, boom, the light turns on. That's the reaction, cause, reaction. In this case, the cause is adding T, and the reaction could take weeks until you actually start seeing about it. So with some people, could even take months till they start seeing. So it's very difficult to make changes, because every change you make, it could take quite some time until you start feeling either a better effect or a worse effect. So the first thing is you start with testosterone. Let's say you take 150 milligrams a week in whatever application. For me, it's either the daily injections or daily cream administration would be the best. You prevent that whole high one day and then slowly lower, 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 lower. You don't get that. You just keep a nice, solid, consistent level every day. And you try that out. And if you're feeling better, you can say, okay, well, let me try now this month. Let me try upping my test dose. a little bit more. And I'm going to try that out for a month. And I'm not going to take anything else. I'm not going to change anything else. Let me see. Do I feel better? Yes. Okay. Well, why don't you try a little more? You can try a little bit more. Maybe try a little bit more and you say, I'm not feeling as good. I feel nervous. I'm not sleeping as well. I feel like overstimulated. Okay, so that amount is probably too much. Back it down to your previous dose. Try that out for a while. Okay, this is the dose. I feel good. Great. And once you've been on it for a while, you can then try adding something else. You can have DHEA. DHEA is not legal in Canada. It's not legal in some countries, which is retarded because your body makes it. And when you optimize those levels, it's great for you. I get them on Amazon. I find sites that they just ship it to me anyway. And in the US, you can just go to any pharmacy and get it. Same thing, add 25 milligrams of DHEA in the morning and just do that for a couple weeks and see how you feel. Maybe you're going to break out in acne. If you do, okay, well, this isn't something I should take. Back acne, face acne, some people feel fantastic. Well, if you feel fantastic after a month, try doubling it. Try taking 50 milligrams, maybe one in the morning, one at night, and try that for a month and see. And if it's great, well, okay, this much test and this much DHA, perfect. Let me now try something else. And if you just take everything at the same time and suddenly you can't get it up, as an example, what caused it? So maybe there's doctors there that just have so much experience with this stuff that when you get a side effect, they're like, oh yeah, I know what it is. It's this, and that. But I don't see how that's possible. We're all biologically unique. So if there's a risk for that even to occur, where you're taking a whole bunch of stuff at the same time, and there's a chance you're going to have side effects, why do that at all? Because then I did that and I wasted 3 years of my life fiddling around with dosages and this and that. It's just recently in the last probably 4 months, I said, okay, I'm just going to start with test. I got my test level dialed in. I'm going to add, vitamin D. I got that dialed in. I just recently added DHEA and I'm going to see, maybe it's going to feel good for me. Maybe it won't. And that's key. It's absolutely key. The other thing you got to keep in mind is that every time you make a change, your body now needs time to adjust. If you're taking testosterone, you're raising your levels. The body now has to balance everything else out. So there's a period where you might even feel a little off, and it could be normal. I remember, giving myself a little bit more tests, and I felt off for a week or two, and then suddenly I started feeling a lot better. It's just the body needs that time to okay, there's all this testosterone now. How do I make use of it, and what should I change? And it balances itself out. And that's one of the key benefits of doing daily administration is because if you're doing weekly and you're having that thing, here your body's 1 point, but 3 days later you're running out of test. And your body's like, okay, I don't have any tests now. What do I do? And it's got to readjust, and it's constantly readjusting. I just like to just feel the same every day. The body is like, okay, this is my new normal, so to speak. What else could I bring up? HCG. For those of you who are reading that in the forums, or your doctors brought it up, some doctors are saying, oh, HCG, it's fantastic. So what does HCG do? Well, your testicles make testosterone. They produce testosterone naturally. Your body produces it naturally. As soon as you start adding testosterone that you're adding it to your body, it's called exogenous testosterone. So it's basically coming from the outside and you're putting it in. Your body now has to adjust. So what your body was producing before will stop, because your body's going to say, hey, there's all this test here. I don't need to make any. There's plenty of it. So it basically tells your testicles, like, okay, just stop. There's enough. You don't need to make any more, and they stop. What happens is when you're on TRT for a period of time, that whole process just comes to a halt. And if you were just going to stop taking testosterone out of a blue, well, guess what? They're not just going to magically come back to life and start making whatever testosterone they made before. You have what's called shutdown, and it could basically take a good long while for that to come back to normal. And some people it does, some people it doesn't. In very few cases it doesn't. Most of them it does, but it can take some time. So when you're getting on this journey of TRT, typically you have to say to yourself, I want to do this. I want to feel good. It's going to make me healthier. It's going to prevent a ton of different types of diseases. Most diseases is basically caused by inflammation. And I'm doing this for my long-term health, and I'm making a long-term commitment to do this. And if you do that, then this is the right thing for you to do. If you're the type of person like, I'm going to take a supplement for 2 weeks and then fuck it, I'm gonna, I won't bother. Then this isn't something you want to do. So
it's a long-term commitment, but it turns a man infertile, low sperm production. That was where you were going with the.
Yes, exactly. So when they start shutting down, sperm production starts kind of slowing down. I had my sperm count measured at one point because I was trying to get my wife pregnant and it just wasn't happening. And I said, maybe it's the testosterone that I'm taking. So HCG is great if you want to remain fertile. You can take 500 IU twice a week. That too is injections. And that will basically send a signal to your testicles to basically say, hey, forget the testosterone you're seeing in the system, forget everything you're seeing, just get back to work and just do whatever you're doing before, just to explain it in simple English. For people that are planning on getting off TRT, well, that's great because they're still working, they're still doing its job. There's a lot of people that believe that taking HCG is good to take regardless. I completely disagree. I felt like absolute crap when I took HCG. I know I've spoken to at least 100 people that felt crap when they take HCG. One of the primary reasons why people take HCG, and this just blows my mind, is when you start taking testosterone, and like I said, you start getting the shutdown, well, guess what? Your testicles actually will get a little bit smaller. They're not going to go to this. They're going to get a little bit smaller, okay? And some guys are just so hung up on the size of their balls that it's the size of my balls that makes me a man. No, your wife has never told you, in the words of the very respected Dr. Keith Nichols, your wife has never told you, honey, your balls were amazing last night. Okay, no woman cares about the size of your balls. And if they're obsessed with the size of your balls, maybe you should get a different woman. Okay, they want to make sure that everything else is working great. Okay, that is irrelevant to everything else. So they're taking it for that purpose. If you don't need to be fertile, stay away from HCG. It just complicates things. You wind up with side effects, and you're like, is it the HCG? Is it the test? Is it something else? Keep it simple. Stick to the test, and go from there. For those of you injecting, I can show you something that I learned recently that I can't believe it took me this long to learn. And somebody showed it to me, and for me, it was great. For those of you injecting, you're probably aware, if you've noticed, that you load up your syringe, and then when you do inject, you wind up with a lot of waste. There's oil that gets left inside the needle in here. And after injection, if you pull back on the syringe, you're going to have about 0.5 ml of waste. Okay, I'm going to just really quickly show you what I do to avoid this from happening, and it's the greatest thing that I ever learned. By the way, for those of you that get prescription testosterone, this is what we get in Canada. So it's just a little vial of oil. Okay, it comes in a small vial like this. I get a prescription for this for once a month. My wife has fantastic insurance with her company, and it covers like 95%. It literally costs a couple of dollars. So when you're doing injections, you basically will tend to use a much larger, scarier needle like this. As you can see, this is that's a big sucker. I would not want to put this in my body. That would probably make me pass out. I basically use this to pull the oil into the syringe. So what I do is I have a little bit of air. Okay. I go into the syringe. I push air into the vial because I'm going to be pulling oil out. So if I'm going to pull oil out, I have to replace it with something because this is kind of pressurized. You're going to put air in to take the oil out. I'll take out precisely the amount I need. What I guess I'll do is I'll just load up a syringe, let's say for tomorrow. I'll take out precisely the amount I need. And I'll just show you something that I think is really, really cool. Put this back on here. Okay, so what I used to do was I would draw the oil while the syringe was inside of the vial. So obviously there's oil throughout the whole needle and all the way to the syringe, and I would stop it at wherever it was, okay? But if I wanted to inject, let's say, you know, 0.1 ml, well, I wasn't really injecting 0.1 ml because it was 0.1 ml plus whatever was in here, okay? Once I would take this off and I would put on my small injecting syringe, okay? So now I'm left with whatever amount of oil I was gonna inject. So what would happen is, as I would push on the plunger, I would inject, but there would be waste left in the needle. And I was trying to figure out, how do I go about not wasting any? And the trick is super simple. All you do is you leave about, I don't know if you can see this clearly enough or not.
Yeah.
I would leave about 0.1 ml of air at the top, okay? And then what I would do is I would flip this upside down and I would wait for the oil to come down to the bottom. For some reason, it's doing it really slow this time. There we go. I would wait for all of the oil to go down to the bottom. And now here I have air. So now I have oil, I have air, and I have the plunger. I would push down on the plunger just a little bit to push out some of the air that was in the needle until there was a little drop left. Like you're seeing right now, there's a tiny little drop at the end of the needle. And when I would give myself the injection now, the air that is in the syringe will basically push through all of the oil into me. So when I pull my syringe out and I look at the syringe, it is completely empty. So what that means is I am now finally injecting precisely the amount of oil I want to inject without wasting a single drop, which is fantastic. So for those of you injecting, definitely try that out. Measure your amount within the syringe first. Forget everything in the needle, airlock, and so on. So I don't know if you guys got any questions. I did have some kind of notes that
I gathered some questions in the meanwhile from the chat box for you.
Sure.
First one was, how long did it take to feel better once you started TRT?
In my case, it took a long time to feel better because like I said, I was starting on the gel, and then I started on the cream. Then I started doing the injections, and I was doing them like once a week. So like for a day, I thought I felt better, but then a couple of days later, I was not feeling quite as good. I want this to be kind of a video that I wish I could have watched when I started 4 years ago. So if I could go back in time, I'd say, Danny, do daily administration. Just do that, and you're going to start feeling better a lot sooner. I would have started feeling better within literally a couple of weeks, you know, maybe a month and a half. I would have started feeling better for sure, instead of the time that it took to start feeling better from all the nonsense I did before. That's key. And like I was saying earlier, not taking a whole bunch of stuff at the same time. I'd say probably once I started the injections in particular, I was doing the injections. Once I think I went about twice a week, I started feeling a lot better.
Mm-hmm.
The first thing I noticed was sleep. I'd wake up before my alarm. Like, that's weird. And I was just wide awake and I felt rested, and I got up and I started doing my stuff. I'm like, it felt foreign to me to be awake after I slept for 8 or 9 or 10 hours. Mm-hmm. I also noticed, I know you guys know the expression called morning wood, when you get an erection during the night or you get an erection as you wake up in the morning. That's normal physiological behavior when your hormones are doing well. I hadn't had that in I don't know how long. So I would start waking up. I'm like, what the hell's going on? Like, this is what am I, 16 again? Energy started, you know, with every passing week, every energy is getting better and better and better and better. You guys just make sure that you don't think, oh, I'm going to start this and tomorrow I'm going to go to the gym and be like, oh, and no, it takes a while. You want to give it literally a few months until you can really make a proper assessment. I'd say probably even 3 months So whatever you're starting today, just say, hey, I'm doing this now, and the benefits are gonna come. They're just not gonna come now. Everybody wants something now, and that's why a lot of people just decide they want to take all these other compounds. You go on these forums and you see these guys, oh, I take, vitamin B12 and I take my B complex, I take my vitamin C, I take my multivitamin, and I take my zinc, and then I take my melatonin, and I take this and I take that, and but my libido is off. What do you think it is? How the fuck are you supposed to know what it is? You're taking 20 different things. You know what I mean? Like it's you guys just use your head one thing at a time. Give it the time.
Okay. Another question I have, you mentioned changing one parameter, one hormone at a time, of course, and waiting to feel the effect before you change the second one. But once you're all dialed in, what other supplements, not hormones or therapies, but what supplements do you have to take along the TRT? I'm thinking magnesium, other things.
It depends. It's funny. My wife and I just bought a house, and we're moving in mid-May. And we went through the medicine cabinet before because we were trying to figure out what, we had, a pharmacy worth of supplements. There must have been $3,000 worth of supplements in our bathroom. We went through all the ones that were expired and threw them out. And then we had to go through all the ones to say which ones we want to keep and which ones we want to get rid of. I wasted so much freaking money on supplements and vitamins and this and that and on and on and on and on. And until I get the essentials worked out, testosterone is the most important one. Vitamin D, extremely important. Take 5,000 IU vitamin D a day. It's great. Some of you won't be able to handle it. When I first started taking vitamin D, it would kill my libido, and nobody understood why. Start slow. Take 1,000. Try that out for a couple weeks. Take 2,000. Try that out for a couple weeks. So test vitamin D, DHEA. I would say are the top three. You want to get these as best as you possibly can first. Obviously, you want to get some exercise. Obviously, you want to be eating well. But those are the three you want to get done first. Some people swear by taking another one called pregnenolone, which is like the mother hormone. That one converts and cascades into all the other hormones. I myself, again, I take that. My libido is shot. Other people in your forum have said the same thing. Darko Markovic, if he's watching, exactly the same thing. Don't waste your time on the damn supplements. Try to eat healthy. If you've gone to see a doctor and a doctor's done a kind of a nutrient analysis on you and says, oh, you're highly deficient in niacin, as an example, then yeah, take niacin. You're deficient, but get those dialed in. I think what I'm going to do is I'm going to get those dialed in as best as I can. I'm still figuring it out. Frankly, I'm still figuring it out, but I know now I'm on the right track. I have the right approach. It's a logical, rational approach. It seems to be working. And once I got that dialed in, I might get a type of nutrient analysis to figure out what am I deficient in. Because it's great to say, well, I need a B6 complex. Well, are you deficient in B6? Are you deficient in vitamin C? Are you deficient in? You might not even necessarily need any of this stuff. And if you want to start optimizing vitamins and minerals, well, then you might have to take all of them. And then it just gets out of control. So just keep things simple. Just keep it simple.
Great advice. Yeah. I agree. I have some more specific questions for you, 3 more from the chat box. Sure. About the needles and the practical things. A man asks the exact needle size. How small can you go for injecting the quads, he asked.
For injecting in the quads. Okay, so guys, there's 2 different ways of injecting. There's what's called intramuscular. Intramuscular is basically you're injecting into the muscle. And then you have subcutaneous, also called sub-Q, where you're injecting into the fat. Some people prefer one, some people prefer the other. With intramuscular, I don't particularly like the sensation. You need a longer needle because you have to penetrate through the fat. Let's say if you're not a very, very lean person, you have to penetrate through the skin, through the fat, and you want to get it deep enough into the muscle that the muscle absorbs it. My experience doing intramuscular is I kind of felt like I was absorbing the testosterone too fast, and within a day or two, I would go. When you're doing subcutaneous, you're doing it into the fat, and I feel that when you're doing it into the fat, your needle isn't quite as long, so it's a lot less intimidating for people who like maybe are needle aversion, have an aversion to needles. The testosterone gets deposited into the fat. In the fat, there are tons of blood vessels. Everything is circulating, and it slowly releases it over the course of the day into the system. Personally, I felt much more balanced doing it sub-Q than I ever felt doing it IM. With IM, it was very much up and down. In regards to what type of needle size, I have two different needles that I use. I'll show you really quick. So to draw the oil out of the syringe, I don't know if it's coming out backwards or not, but these are 18 gauge. I don't know if you guys can read that or if it's backwards or not, but these are 18
gauge. Yeah, I can see it, yeah.
Okay. So the 18 gauge 1 inch is kind of like what I had showed you a moment ago. Just very quick, if I do this, I'll pull this out. Okay, so you can see this is a you know, if I put it next to my finger, you can see this is a good size needle. If I had to jab this in me, I would not be a happy guy. The reason I use this is because the oil is fairly thick, and the bigger the syringe you use to pull the oil out, the easier it is. Okay, so that's kind of what I use. Basically, as you can see, I can twist this off. So this needle comes off, and then I can put my small little injecting one. So the small little injecting one are, if you can see here, these are 30
gauge, yes.
30 gauge, half inch, because I go into belly fat. With needles, the gauge, the higher the number, the smaller the needle. I know it's very confusing. So these big suckers are 18 gauge. These ones are 30. Now, why do I use 30? Some people might say that's too small. It is kind of small. I have some 27s as well. So 27s, the needle is slightly bigger. When I use 27s, I feel a little bit more discomfort, if you will, when I inject into belly fat, but I'm able to push down on the plunger easier because the needle is bigger, the oil goes through a lot easier. When I'm using these small little 30s, I feel much less discomfort, and I don't like to have discomfort if I don't need to. But I really have to put pressure on the plunger and really go slow and take the time, even for that what little amount. I just had a preference for this. The other weird thing about 27s is every time I've used 27s, after I finish injecting, I've always noticed some oil seeping out of the little tiny hole that it made. Whereas with these, the hole is just so unbelievably tiny that nothing seeps out. What do? It's part of my morning routine. So like I said, I'll take my shower. I get out of the shower. My skin's all hot. Everything's hot. I prepare my little needle in the body fat, and I just, you know, with my thumb, if you will, I just push down on wherever I injected to let, you know, everything kind of circulate and not stay in one spot. On a very, very, very rare occasion, I might get a tiny little bump. That happens less and less. For those of you doing sub-Q injections, if you're going to do, you know, once a week, you got to inject quite a bit. And that quite a bit, you're going to wind up with these big red nodules, and that's normal. Even if you're doing it twice weekly. When you're doing daily, you're doing such a tiny little bit that it doesn't really react. And again, this whole thing that I just said about tiny little bit, I'm absolutely convinced that giving the body a tiny little bit of something on a consistent basis is always going to be better than just giving it a big, huge dose once a week, and your body's like, whoa, what does all this come from? Well, we're not gonna, you know, you just give it a little bit and you just keep things nice and stable. That is, for me, it's key. It is absolutely key.
Yeah.
If you don't think you could ever possibly do these, you could also go with cream. Right now, the general consensus is apply to the scrotum. Guys will basically shave part of the scrotum, or at least trim the hair like really, really short, and they apply the cream there. It just rubs it in, and it gets absorbed, and that's it. I'm sure there's probably pros or cons about in regards to both. I'm toying with the idea of trying the cream just to see what kind of difference it made. But right now, I'm happy with the results I'm getting with this.
Yeah. Okay. Okay. As you know, you have maybe seen it because it's the most popular video on my channel. It's about subcutaneous inflammatory nodules.
Yes.
On injecting long esters. Actually, in Belgium, we only have Testosterone. These are long esters meant to be injected 200 milligrams for 3 weeks. That's what the leaflet says. Well, it's crazy, of course. But even when guys inject smaller doses twice a week, a lot of them get these subcutaneous hard nodules. I have been told by people in the group, like Mike Cox is from Balance My Hormones in the UK. He also says these long esters are not to be injected subcutaneously because they cause these hard inflammatory nodules very often. So you can watch that video on the channel.
So believe it or not, I'm using in Quebec. I'm from Quebec. I'm in Montreal, Quebec, Canada. For those wondering, when we go to the pharmacy and get it prescribed, it's enanthate. And enanthate, the half-life is fairly long. I think it's 8 or 9 days or something like that. And again, just because I've been injecting such tiny little amounts, I just never get those nodules anymore. I only got them when I was doing the weekly or biweekly.
Someone, that was a question that I still had for you. What ester do you use and what dose daily?
Yeah. For those of you wondering what the hell an ester is, you want to think of this oil as a delivery system, if you will. If I just injected pure testosterone in my body would assimilate it and it would be gone in no time. The oil contains something called an ester. The testosterone molecule attaches to the ester, and it basically allows the testosterone to be absorbed or metabolized slowly over time instead of all at once. So there's some types of applications where the half-life is very short. When I say half-life, what do I mean? If let's say you want to use 100 milligrams of testosterone, and let's say it's something that's got a half-life of 1 week. What does that imply? It means that you're giving yourself 100 milligrams of testosterone on day 1, and at the end of the week, the half-life is 1 week. It means after 1 week, you basically have 50 milligrams left. That's why I freaked out over that endocrinologist who told me to take 400 milligrams once a month with a half-life of a week. So what did that mean? Well, that means that 400 milligrams is the first day, and then halfway, after 1 week, I've got half of that, so now I've got 200, and then the next week I've got half of that, so I got 100, and the week after that I got half of that, so I got 50. So can you imagine how up and down you feel? By sometimes you've got 400 milligrams, sometimes you got 100 milligrams, sometimes you got 50 milligrams. And by the time it's the day before the injection, you're like, just give me the shot. Like you just want to throw yourself off a building, and it's crazy. I don't know. Some of you are using cypionate, some of you are using enanthate, some of you are using propionate. You got Testosterone. You've got someone else mentioned they use. The other one with extremely long ester, 28-day ester. Anyways, whatever. But I don't think it makes that much of a difference. I'm convinced that if I used enanthate or I used cypionate or I used propionate and I was doing these small little tiny sub-Q injections once a day, I don't think it would the slightest.
No, that doesn't matter. Yeah, exactly. So this system, for the viewers that don't know, is a mix of 4 different esters, each with a different half-life. It's the only thing we got in the UK and in Belgium to be injected. And I had one practical question for Danny about that, because they come in ampules from 1 milliliter in glass. And once you open it, you can't keep it sterile. So it is meant to be injected for every 3 weeks. So
Right.
Do you have any practical tips on how to keep the rest sterile if you only take a little bit out?
I've never had to take it, so I'd be the last person to give advice. I really have no idea. You'd have to. So in Europe, you're saying a lot of you are only being able to get testosterone, and
yeah, in a lot of countries we only have testosterone to be injected. Yeah.
Oh, the one I was thinking of was undeconate, which is apparently a 20-day half-life. Could you potentially just load up a bunch of syringes?
Yes, exactly. I have seen people online doing that. So they load up all syringes and they put it in in a sterile place,
Yeah.
and they just take one every day.
Yeah. And I'm not I don't think you'd even have to refrigerate it as long as it's just in this. I mean, I just opened that syringe now. It was sterile. I opened it up. If I load it up and just put it in a place that,
Well, there's not a lot of risk. Well, you take it in your own hands anyway, because it's not like prescribed on the leaflet of the product. So
yes.
yeah.
Yeah.
One more question I had for you, maybe back to the low T symptoms. Jorn in the chat box asks, what are the real medical risks of having low testosterone? For example, levels about 200 at the age of 40. What are the medical risks about that?
There's just a ton. There's a lot of really good articles and stuff out there where that really go into detail. Here's the thing. I see this every day, and I'm sure you guys see this every day. Have you ever seen these, slightly older people in their, their 70s and their 80s, and they're walking around hunched over, they got the cane, they're weak, they're frail. Can you imagine how any type of disease or anything that they get, how little their body would be able to deal with that? In my opinion, having muscle basically results in good quality of life. The more muscle that you can put on now, and the more muscle that you can try to maintain later on in life, the better your quality of life is going to be. If you take an 80-year-old guy who's been going to the gym and staying in shape and has got a good amount of muscle versus an 80-year-old guy that never lifted a weight in his life and is like a little toothpick, I guarantee you that the first guy is going to have a better quality of life. When your testosterone is low, it brings up a whole bunch of problems. I've got family members, friends, some older family members, some older friends, and they tell me, I'm taking this medication for this, and I'm taking this medication for this. I've been on my antidepressants now, and I haven't had sex with my wife in 3 years because I'm on antidepressants. I don't want to have to. And so many of these things that they're telling me, I'm like, if the guy would just take some testosterone, just put it back and get his body back to where it's supposed to be, he probably wouldn't need any of this stuff. There's so many diseases that are just caused by inflammation, and just having a healthy levels of test reduce that inflammation, reduces the chance of having that disease. Frankly, since I've had my levels up there, I think I've been sick twice in the last 3 years. I don't even get sick anymore. I always feel good. Everyone around me gets sick with colds and the flu, and I'm fine. And the older people, those are the ones that I have the hardest time, trying to convince. Let's say a guy like my dad. My dad can drop down and give you 60 push-ups on the fly, and he'll look at you and just smile. And he's 72 years old, and he's giving a push-up. He's like, yeah, you do 50 push-ups. And he says, I feel great. I feel great. I just think to myself, how much better would he be if I could get a look at his hormones and just get everything optimize his test and his DHEA and his vitamin D, just to start. What would his quality of life is? What would it be? Yes, he feels great now, but how is he going to feel when he's, 77 or 78? Will it start to take a nosedive? If I was to optimize that now for him, would it, he have a longer quality of life? Bone mineral density. There's just so many factors. Your cardiovascular system, your heart, your brain function. There's so many to mention. And instead of having a doctor just treating these things when you get sick, and that's the big thing. People think, well, I don't go to a doctor because I'm not sick. Okay, but why are you going to wait till you get sick to get some kind of a treatment?
Exactly.
Why don't you take something now to make sure that you don't get sick? People say, Danny, why are you taking tests? You're 45. Like, you look great. You feel great. I look great and I feel great because I'm doing this now. Before, I felt like shit. And if I wouldn't have done anything, 10 years from now, I don't think I'd be too happy with my life, to be honest.
Okay, great.
So it's a long-term investment to have the best possible quality of life possible. You guys got this one life. I'm 45 now. You're turning 45 soon. And I'm going to turn 46, and I'm never going to have 45 again. Why not just make every year the best I can? If it's a matter of giving myself a tiny injection once a day to feel great, why wouldn't you? Why wouldn't you? You know?
Exactly. That's why it's called optimizing, not treating.
Yeah. Yeah. Instead
Okay.
of just waiting for something to go wrong and then have a doctor say, well, you know, you're going to take this medication. That drives me.
Okay. Well, thank you, Danny, for your awesome story. You just went on. It's
I know. Sorry.
yeah, it's awesome. It's a pleasure to listen to. Really, I think a lot of viewers will really enjoy that, learn from you, and yeah, I really appreciate your story here.
Welcome. And if any of you guys got questions, like I said, we have to reiterate, I am not a doctor. I did not go to med school. I'm just a guy that likes to solve puzzles. And if I got to solve a puzzle, I need to get as much information as possible to let me solve the puzzle, because no one else wanted to solve my puzzle. And I tried a bunch of stuff, and some worked and some didn't. And, you know, join the Facebook group. You can maybe leave a link in the chat box in the description. Join there. There's doctors there. There's really, really knowledgeable guys there where you can post a question and you can have all kinds of guys just chime in with their opinions. A lot of them really know what they're talking about.
Exactly. Join our Facebook group. The link will be under the video in the description. Danny is in there and he helps on a daily basis. Next to a lot of other TRT experts, doctors in there that make a living of it. I'm just in it out of thankfulness for all the help I got online. I'm really glad I met all these great guys like Danny. It's a pleasure to help each other and find what you need.
Yeah, that's one thing really important, guys, about this group is that nobody is there for any type of financial gain. You know, Stephen has his own practice that has nothing really to do with TRT. He's a dermatologist, as you guys probably already figured out. I've got an IT consulting company. He and I are just here because it was really tough to figure out. We're still learning. We're still figuring out. The more we learn, the more we realize how much we don't know. And it's this constant thirst and this constant quest for new knowledge. And as we're discovering stuff, we just want to share and help to at least get some people started with a little bit more information than the way we started off. So
Exactly.
get them feeling better quicker. So yeah, nobody's there trying to make a buck or charge you a monthly fee, or it's all just guys sharing their knowledge, which is really, really nice.
And the thing is, a lot of people, as mentioned in the chat box by someone, have exactly the same story as you have, as I had. Just the same thing, just the same thing. I had low levels, I felt bad. I went to a neurologist, he gave me androgel that took up my levels, but I didn't feel better. Then I started this Sustanon. Luckily, I can prescribe that for myself. And I asked advice at the urologist, and he said, just go to a transgender clinic. So can you believe that? Another doctor that doesn't have a clue what he is talking about. So he admitted it, and he referred me to a transgender clinic, whatever. So I did online research. I met all you great guys, Dr. Keith Nichols, that I'm eternally grateful to. He helped me out, and he put me on the compounded transscrotal test cream, which helps me just like you are helped with your injections. Probably my levels are even a bit higher than the normal range, and I feel great. And after that, I also took DHEA, pregnenolone, and all the rest. So one step at a time, guys. I think we have to round this up here. We're over the 1 hour mark. I really appreciate Danny's contribution to the channel, and I will surely have him back on another time.
Sounds good. My pleasure.
Okay, we'll stop the recording now. Bye, guys, and see you next time. Give us a like, and I'll see you.